Hello, and welcome to the Great Wall China Adoption Waiting Child Program Special Needs presentation. The goal of this presentation is for us to portray to your family some of the common medical needs that we're seeing come through the program. This should help give your family some talking points, maybe a good place to start on researching these medical needs. It's really important to understand that the matching process is a very collaborative process between your family and our agency. We'll start educating you more about these needs. You can find resources in your area, but ultimately your family gets to decide what you feel is manageable. We can do this between, again, understanding the resources in your area and finding specialists to talk to. Let's start off talking about heart defects. Congenital heart defects are one of the very, very common things that we see come through the program. What they are defects that happen in the heart while the child is still in the womb of the mother. A lot of them can be associated with other medical conditions such as Down syndrome, but one of them does not cause the other. It's important to know that whenever you're looking at heart defects and you're seeing a lot of different heart defects together, they can become more complex, but these really run on a spectrum. A lot of what happens in the heart is the fact that oxygen-rich blood and oxygen-poor blood are probably mixing, or the child's not getting enough oxygen to the rest of their body. So this causes some other development delays in the child. So that's really important to know whenever you're looking at heart defects in general. It's really important that you consult a physician about every individual heart defect that there is in order to have a much better idea as to the spectrum that these heart defects run on. They can be mild, moderate, or severe, and again, that's going to have to be something that your family really decides. A mild heart condition can be defined as maybe only having one heart defect. It might not necessarily need surgery. It might be managed with medication, or it might be treated with one minor surgery. A moderate heart defect would be defined as having maybe one or two heart defects up to 4 or 5. These would probably definitely require surgery and maybe ongoing care. A severe heart condition would be defined as any heart defect that would require significant medical interventions, possibly even not to have a correction. These might range from having multiple open heart surgeries to possibly even having a heart transplant. So tetralogy of Fallot, or TOF, is one of the most common mild to moderate heart defects that we see come through our program. It's rare, but in our program it's actually pretty common, and it causes a lot of cyanosis, or lack of oxygen to the rest of the body, which causes a lot of maybe blue lips and blue fingernails visually, but inside it also causes them not to be able to participate in a lot of activities. It's essentially when the oxygen-rich and oxygen-poor blood become mixed, and that allows the oxygen-rich blood not to be able to get enough oxygen to the rest of the body. They might seem really healthy, kiddos that are born with TOF, but pretty soon after they're born it does become apparent because, like I said, visually they'll look pretty blue. Depending on the severity of it, infants will either undergo complete surgical repair, or they might wait a little while till the baby gets larger and the heart gets larger. And a lot of this is based on how much are their oxygen saturation levels in their blood. PDA is another one that we see very commonly. It affects babies really soon after birth. The duct is a passage in the heart that's meant to close shortly after birth. When the unborn baby is in the womb, there's no need for the baby heart to send blood to the lungs because it's getting everything that it needs from its mother. That duct that's in the heart acts as a bypass, allowing the blood to flow back into the heart without entering the lungs. Shortly after birth, this should close as the baby begins to breathe normally. However, in PDA, this duct does not close completely. This means that some of the oxygen-rich blood that is meant to be pumped away from the lungs leaks back through the ducts and into the pulmonary valve and into the lungs. It's typically treated with medicines, catheter-based procedures, or even surgery. The goal is to close that duct. Closure will help prevent any further complications and will help increase the blood volume. A lot of times small PDAs will close by themselves without any type of treatment. It's important to know that kiddos, whenever they do have any type of heart defect, and they're in the orphanage, a lot of times they are kept separate for the orphanage to keep additional eyes on them, especially if they're showing signs of their heart defect. So that may mean that, that the kiddos are not able to run around and might not be getting enough stimulation. That can cause development delays, and these are not things that are biological inside of them. It's not, that they have a condition that causes these delays. It's environmental. So a lot of times when those kiddos come home, they are able to catch up. Thalassemia B major. So thalassemia is a blood disorder that is inherited. It's characterized by less hemoglobin and fewer red blood cells in your body than normal. Red blood cells are the most common blood cells with the principal mean of delivering oxygen through the body. Hemoglobin is the protein in the red blood cells that carries oxygen and is made of two proteins. It's alpha globin and beta globin. Thalassemia occurs when there's a defect in a gene that helps control the production of one of these proteins. This disorder results in in excessive distribution of red blood cells, which leads to anemia. The genes that are involved in thalassemia B major is involved in making the beta hemoglobin chain. When a child has two mutated genes, this is considered thalassemia B major. Symptoms will be moderate to severe. The condition is also known as Cooley's anemia, and children will require regular blood transfusions. So what is the treatment for thalassemia? The type and amount of treatment or a child will need will depend on how severe the condition is. For most children with moderate form of thalassemia, they will acquire an occasional blood transfusion, while children with a severe case may require regular blood transfusions. And for severe cases, they may require that blood transfusions happen very, very regularly. This is a huge need that we see in China, and the reason for that is the fact that China doesn't have a good blood supply there. They don't have good blood banks. They also don't have chelation therapy, which is very, very important for kiddos with thalassemia and is not available in China. Without this, early mortality is inevitable for these waiting children. There's also currently, like we talked about, a shortage of blood in China. So it's very, very urgent for these kiddos to come to the United States in order to receive appropriate treatment. Another very, very common need that we see is cerebral palsy. It's described by a loss or impairment of the body movement, muscle coordination, or motor functions. This disorder always comes from a trauma to the brain. Most of the time this happens in utero. The trauma to the brain happens. And then once the child is born, there is a lack of movement, which causes muscle contracture. CP can run on a very, very large spectrum. Sometimes kiddos might not be able to use a hand fully or a foot fully, but this is not something that can be corrected because it's based in the brain. So a family would have to realize how to manage this. It's definitely very manageable. You can do a lot of therapies. You can get different types of massage and stuff like that. Cerebral palsy doesn't get worse over time. It's not something that is progressive or anything like that. Once the damage to the brain happens, it happens. It can cause other things if the damage, depending on where the damage in the brain is. So if the damage in the brain is very, very small, it might only affect a little bit of the body. If it's larger or in an area that affects, your language or your learning ability, then it might also affect those things. But cerebral palsy by itself, like I said, is very manageable. Symptoms definitely vary between people depending on where in the brain it has affected. A loss of coordination, you primarily see it in your gross motor skills, but then it can affect those really fine motor skills. So treatments are some therapies, surgery maybe to release some of those muscles, but overall it's just managing the physical condition of the body. Urogenital issues are another thing that we see very commonly. They kind of run in different types or different categories. Hermaphroditism or intersex genitalia is a group of conditions where there is a discrepancy between the external genitalia and the internal genitals. A baby might be born with undescended testicles but also have ovaries. In general, with the children from China, this will refer to a child who has a chromosomal abnormality. Often we see children who have malformed genitals mislabeled as hermaphrodites. Another one is underdeveloped or ambiguous genitalia. It refers to genital malformations that do not include a chromosomal abnormality. This may be an enlarged clitoris. It may be a concealment of the vagina in girls, or severe hypospadias or abnormalities in the penis, maybe a micropenis in the males. Treatment for this may include reconstructive surgery and/or hormone replacement. Hypospadias is somewhat common at birth. It happens in utero, and it's where the opening of the urethra is on the underside rather than at the end of the penis. This condition definitely varies in severity depending on where the urethra is opening at. In most cases, the opening of the urethra is located near the tip of the penis or on the underside. More severe forms of this occur when it's at the mid of the shaft or at the base of the penis, or possibly coming out of a testicle. Imperforate anus is a congenital defect in which the opening to the anus is missing or blocked. The rectum may end in a blind pooch that does not connect with the colon. It may have an opening to the urethra, the bladder, the base of the penis, or the scrotum, or vagina. The condition is maybe when the anus is narrowing, or the absence of the anus may be present. With treatment, the outcome is usually good. It just depends on where exactly or how exactly this is going on inside of the body. Incontinence is another one that we see a lot, and it simply means that the child cannot control urination or defecation. It could be caused by, a nerve ending disorder. It could be caused by a physical malformation of the urethra or anus. It just really depends. There's many different types of therapies in order to manage this or even possibly correct this. Limb differences. So limb differences are another one that we see very, very commonly. It can refer to the absence or malformation of a limb. The cause is usually unknown. It can be clubbed hands or feet that may require surgeries or casting. It could be a loss of a finger, toes, hands, arms, or legs. And all of this can really vary. Looking at correcting it can vary, looking at possible surgeries. All of this will vary depending on the type of limb difference your child may have. Most of the medical literature states that children who are born with limb differences don't feel a sense of loss. This is their body. This is what they've known growing up. So correcting it may be possible in order to help their function, but a lot of times it's not due to an emotional connection that the child may have to a limb. Many of these kiddos also live very, very full and very active lives. Spina bifida. So what is spina bifida? It's a birth defect that involves the incomplete development of the spinal cord or its coverings. The Latin term is actually known as split or open spine. The most common ones that we see in our program are meningocele, and that occurs when the fluid leaks out of the spine and pushes against your skin. You'll see a bulge or a sac form in the back of the spine. In many cases, there are no other symptoms except that there's a sac, or it can be rather large. A myelomeningocele occurs when part of the spine nerves push out of the spinal cord, and then you actually do see you again see that bulge. Some children with spina bifida may have already had treatment. A lot of these are treated immediately when the child comes into care, but some may still require surgery. Children with spina bifida also often have problems with their bowels and bladder control and could have incontinence. Some may have ADHD or other learning disabilities and hand-eye coordination. Some of them also may have difficulties walking afterwards, especially if they had a myelomeningocele. Maybe some of those nerve endings were severed in surgery. So these are all things to keep in mind. And if you ever see spina bifida paired with hydrocephalus or any other type of spinal deformity, then a lot of times we see that the risk for those are even greater. Sensory complications. There's a lot of different sensory issues that we see in the kiddos in China, and something that's really important to realize is if any of these are present in your kiddo, then a lot of times they don't have the resources in order to manage this. They don't have the resources available. So your children may be diagnosed with glaucoma or cataracts, which are both vision concerns and are correctable and very manageable here in the United States. But because of that, they don't have the resources in order to educate. So a lot of times these kiddos are labeled as developmentally behind, when really it's the fact that they're not being really taught anything. They might be kept in a crib a lot of the times. They might not be given any environmental stimuli in order to have a typically developing child. Same goes with any type of hearing loss or deafness. These are all things that we just see that they don't have the resources for. A lot of this, again, is very manageable here in the United States. It's just a matter of kind of getting beyond what might be in the file and looking at the overall picture of this child. Reviewing a file, looking deeper. So what does it mean to have a special need in China? A lot of times what it means is that these children are not able to go to school for lack of resources. If a child has a severe deformity that is very apparent by looking at the child, a lot of times they're kept within the orphanage. So we see a lot of institutionalized delays and lack of educational opportunities because China doesn't have the resources for it. So in looking, whenever you're reviewing a file, it's always really important to know more about these institutionalized delays, to know if a child may be on target for their peers and not for an American child. Same goes whenever you're looking at measurements. It's going to be really important to get a World Health Organization Chinese chart to measure these kiddos on, to plot their measurements, and because they're going to be significantly smaller than American children. And then looking at developmental milestones that are appropriate for an orphanage is something that's really important. And you'll get a packet from us here at Great Wall to help start to look into some of these things a little bit deeper. So thank you so much for watching this video. I know that y'all probably have tons of questions about these special needs, about maybe what we see come through the program. So please feel free to reach us at the Waiting Child program. Thank you so much.